Good day to you, everyone, once again. Welcome to the second part of the BioTalk that we started on Helicobacter pylori. In the first part, we were able to talk about the symptoms and the diagnosis of Helicobacter pylori infection, and today we will be majorly focusing on the treatment aspect, which is actually very, very important to this BioTalk. H. pylori infection is actually a very, very important infection in the world of biomedical and infectious science. So, because of this, the European Society of Pediatric Gastroenterology and Pathology and Nutrition, and the North American Society for Pediatric Gastroenterology, Pathology and Nutrition also, they have an updated treatment regime for children and adolescents. They have to come together to produce guidelines, especially for physicians, so that they will be able to overcome this infection pending the time that the vaccine would be available for children to take. So there are three major treatment regime that we'll be talking about this evening. So the first one had to do with a triple therapy of PPI, which we referred to in the last lecture as a proton pump inhibitor, amoxicillin, and clarithromycin. So PPI, amoxicillin, and clarithromycin are recommended for 14 days in the treatment of choice, especially if the strain is responding to clarithromycin and metronidazole. If it fails, clarithromycin can be replaced with metronidazole without any further antibiotic susceptibility testing. All this treatment regime that we're mentioning, for information, is actually depending on your physician recommendation. These are research that has been made and that are being stated according to guidelines. So if you're going to be using any of the treatments, you can consult us, because we have a physician on ground as well at BioTalks, or you can consult your physicians too, so that you'll be able to get the best of treatments. The other treatment option is a kind of sequential therapy for 10 days, where the PPI is used with amoxicillin for 5 days, followed by another PPI with metronidazole or clarithromycin for another 5 days in patients that are infected with full susceptible strain. This treatment should not be given, however, if the organism has been shown to have resistance. We always talk about antibiotic resistance in bacteria. So if this if it has shown that H. pylori is resistant to metronidazole or clarithromycin, the sequential treatment should be suspended, and the exposed child should also be monitored concerning the kind of treatment that is being given. Of course, like every other antibiotics, medication should be calculated based on the weight of the child, and I said earlier too, the physician should be consulted as well. Now, the last one is in case there is a resistance to clarithromycin or metronidazole, or when the resistance is not known. So there's bismuth quadruple therapy that can be used, which consists of bismuth salts, PPI, and amoxicillin. Tetracycline can be used to replace the amoxicillin in children that are older than 8 years old, and also metronidazole is also effective. So although there is limited evidence, combination of high doses of amoxicillin, triple therapy with metronidazole can also be used. So of course, all these treatments are very good, but we already know that resistance to antibiotics is a big problem when it comes to treatment of any bacterial infection. And of course, it varies from location to location. So most of the time, when you want to treat, when you've given a first line of treatment and there are no improvements, then there's possibility of resistance. And the funny thing is that resistant testing, antibiotic resistant testing, which we can refer to as susceptibility testing, cannot easily be carried out on Helicobacter pylori because it's very difficult to grow the organism. Even in the lab, it's very, very, very difficult. So most of the time, what is usually being done is to actually check if the antigen is present. If the antigen is present, like one of the tests that were stated in the last BioTalk, the antigen is present and you've used the first line of treatment for this organism and there are no response, then there's possibility that the organism has already developed resistance to that particular drug you're using. The treatment of H. pylori usually involves the combined effort of the physicians and laboratory technologists, especially the medical lab scientists, so that they can reach a good agreement about the dosage and the type of treatment to be given. So that's the concluding part of this about talk on H. pylori. We hope you've been able to learn one or two things. And like I said, if you don't self-medicate, you should, if you need a copy of this, you can get a copy of it on our website. We've already made it available there, and you can definitely print it and show your physician. Please go to your physician whenever you want to discuss any form of treatment. Like I also said the other time, we have physicians at BioTalks that are working with us full time. Or some of them are consulting with us. So if you need a consultation or advices, you can definitely get across to us. So thank you very much for listening. Like I usually say, make sure you take care of your health and be mindful of whatever it is that may be injurious to you. Have a lovely evening. Good night.